I would like to first acknowledge that since I am in Ottawa, I am on the traditional and ceded territory of the Anishinaabe Nation. I recognize that we all work in different places and that therefore you work in a different traditional Indigenous territory. I encourage you to take a moment to reflect on that and acknowledge it. So hello everyone, my name is Rita Houkayem, one of Global Affairs' Gender Equality Specialists that works to ensure that gender equality is always integrated at the forefront of all our policies and programs, and I'm honored to be your moderator for today's session. As all of you know, COVID-19 pandemic is a global threat that does not recognize borders and will only be overcome through coordinated global action. Canada and its Canadian partners have been committed to a robust global effort to stop COVID-19 and address its devastating health, social, and economic impacts on people around the world. We also know that this global crisis will likely exacerbate inequalities, which has, and reverse development gains, in particular for women and children who already experience poverty, exclusion, and marginalization more acutely. Evidence has shown that women and girls are disproportionately impacted and are also facing a shadow pandemic, also known as sexual and gender-based violence, which has increased exponentially around the world. So our work is critical today, more than ever before in these unprecedented times. And so what are we doing all gathered today? Well, we are here to discuss observations that organizations working in COVID-19 response and in communities around the world have made with regards to the effects of the pandemic and social crisis on women and girls. We'll also be looking at how Canadian organizations partnering with local communities can assist in addressing these problems and ensuring that their responses take gender equality concerns into consideration. So we're very lucky to have 5 great panelists from 5 different organizations active on the ground in various parts of the world present their insights and expertise. So we have Danielle Gibbie from Operation Eyesight, Patricia Gumbo from Sihle-Sizwe Vineyard Foundation, Sarah Keeler from Canadian Women for Women in Afghanistan, Danielle Skogen, from Canadian Humanitarian, and Lorraine Swift from Change for Children. So the way it'll work, and I'll give them after a proper bio, the way this will work is each panelist will have 5 minutes to answer a question asked by me, and I will be presenting their bio then. I will also let the panelists know when they have 1 more minute left. So instead of me cutting them off, I'll just do a signal, let you know that you have 1 minute left to wrap up your great idea. And then by the end, after all of the panelists will have spoken and answered the questions, we will then open it up to the floor for the audience to ask a question. And I'll be also picking up the questions as we go. So actually, if you want, you can, even as the panelists are speaking, you can write your questions in the box. I will collect them. In the end, I will ask them depending on time for our panelists. And one last thing, at the end, I'm gonna also ask our 5 panelists 1 question and give them 1 minute to answer, okay? So one thing is I'm gonna ask, I think all the participants are muted, so to stay muted. And like I said, don't hesitate to write your questions and I'll collect them at the end and hopefully ask them all by the end. So to start, I will now present our first panelist, Danielle Gibbie, Director of Institutional Partnerships at Operation Eyesight. Who is she? Well, I can't wait for a photo, perfect, beautiful photo. Okay, Danielle has worked in international development for the past 5 years and has developed a keen interest for gender equity and global health. She joined Operation Eyesight in 2019 as the Director of Institutional Partnerships. In this role, she leads the government relations strategy, advances the funding strategy by identifying, building, and cultivating partnerships with funders and other stakeholders in the global health sector, and works closely with the programs team to generate innovative approaches to scale and extend our impact. Representing Operation Eyesight, Danielle sits on the official development assistance advocacy group for the Canadian Council for International Cooperation and the Gender Equity Work Group for the International Agency for the Prevention of Blindness. Danielle holds a Bachelor of Business Administration from Mount Royal University with a minor in Social Innovation and Nonprofit Management. In 2017, she completed the Aspen Network of Development Entrepreneurs Investment Management Training, covering all aspects of investing in small and growing businesses with a focus on emerging markets. Danielle has held multiple board positions and is currently the chair of the Alberta Council for Global Cooperation and the president of Mount Royal's Alumni Council. So Danielle, thank you for joining us. And to get right through it, the first question is, What are your observations from your work in the last few months regarding women and girls during the pandemic?
Thank you very much, Rita. So I thought I would start by just giving a little bit of background context on eye health. So vision impairment is the world's largest unaddressed disability. Globally, over 2.2 billion people suffer from vision impairment or blindness, and of that, nearly half is preventable or treatable. This burden is not borne equally. 90% of the 2.2 billion live in developing countries where access to care can be limited, and the burden of that is faced by women and girls. Currently operating in South Asia and Sub-Saharan Africa, we partner with local governments and hospitals to ensure quality eye health care services are made available, accessible, and affordable to those in need. Historically, women and girls have been especially vulnerable during crises, and COVID-19 has shown no different. At Operation Eyesight, we work closely with ministries of health, and we were able to develop and implement COVID-19 prevention strategies for the communities we serve, most of which are in rural, remote areas with limited access to essential resources. Our goal was on preventing the spread of the virus and educating these communities to keep themselves healthy and safe. Through this endeavor, we provided essential hygiene items such as hand sanitizer, soap, and hand washing stations to people in need, with a focus on reaching the most vulnerable populations. We train community health workers, over half of whom are women, to deliver health education and awareness to over 600,000 individuals. That's a really key point on the fact that half of those community health workers are women, because women are critical resources in their communities and are really effective at empowering and onboarding solutions for others to adopt. I want to talk a little bit more now about one country in particular that we work in, Kenya. In Kenya, schools have been closed since March. Their school year begins in January and ends in October. So when the pandemic hit, they were only 3 months into the school year. Unlike in Canada, many parents have not been afforded the ability to work from home. This means many children, even at young ages, are home alone. The impact of school closures goes far beyond education. It has impacted the health and well-being of all children, especially girls. Globally, we've seen an increase in gender-based violence, female genital mutilation, and unwanted pregnancies. Schools keep children safe and are a critical source of providing health education, including nutrition, eye health, and sexual and reproductive health. Now more than ever, I think we've all realized that our interventions must utilize a gender lens to address the barriers faced by women and girls. As we move forward in this uncertain environment, Operation Eyesight will continue to address the inequities women and girls face in accessing and utilizing eye health services. We will continue to work with our partner hospitals, governments, and other stakeholders to encourage gender diversity, engaging whole communities in the work we do, especially men and boys. Their involvement is critical to the sustainability of gender-targeted interventions. Our solution is to work within communities, to empower them to take ownership of their health. We will continue to educate and empower women to be catalysts of change in their communities. We know that when women are empowered, communities thrive.
Okay, I was thanking you, Danielle, for sharing what Operation Eyesight does around the world and for enlightening us regarding the gaps that exist and how you've been able to fill up those gaps. So to jump just right into the next panelist, I'd like to present our second panelist, which is Patricia Gumbo, the director of Sihle-Sizwe Vineyard Foundation. Who is Patricia? Well, Patricia is a business and administrative professional with the city of Edmonton, Alberta. Her passion for social enterprise and interest in community development has seen her grow on a non-profit organization called Sihle-Sizwe Vineyard Foundation. This is an undertaking that she has dedicated her after hours and free time to. The foundation's mission is to empower women and children through education and income-generating projects. Itself not a small measure, Patricia also prides herself in being a full-time mother, wife, and avid community mentor who is always on the go to advance the human cause in areas of gender and other areas of life that lack in equality. Patricia is an active player in areas of international development, wherein she has invested time and effort in driving economic emancipation in her African villages and communities by championing self-help projects for women and children. Patricia is an avid reader as well as a gardener of repute. Patricia, thank you for joining us. And diving into your question, it is, how has your organization responded to support women and girls? And what strategies have you considered to scale your organization's gender equality outcomes? So response and scalability.
Okay. Hello, my name is Patricia again. Our organization work is as a result of the experiences of me growing up in Zimbabwe. Our organization mission is to empower women and girls. I was born in Zimbabwe in a family of 9, 5 girls and 4 boys. My mother and the rest of my siblings lived in the village, while I lived in the city with my father, my uncle, and my cousin. The reason for my move to the city is something I never told my mother until I was in my 30s, which is another story for you guys. In the city where I lived, I came to a realization that all my neighbors were single mothers who were somehow working hard to secure homes for their children and themselves. I came to realize that these women were working so hard, buying and selling whatever they got to send their children to school. One thing that amazed me the most was their gardens. Their gardens were always flourishing with vegetables, and they made sure they shared them with me. I was around 10 years of age by then, and my own garden was barely thriving. But I had 3 men in the house who could not even maintain a vegetable garden, while my mother in the village was busy doing subsistence farming and taking care of my 8 siblings. Our organization partnered with faith organizations in Zimbabwe to start a uniform production business. This business is for women and girls. The program participants are single mothers, widows, and young women. The program participants all live in the city of Bulawayo. These women make contracts with schools. That way they know the number of uniforms to make and are guaranteed a full payment at the end. We let these women manage the business and keep each other accountable. Sihle-Sizwe organization and staff on the ground help them with business management and marketing, like setting the right profit margins, payment of business expenses. We teach them about profit sharing and saving for emergency funds. In return, the women teach and mentor other young women. It's a continuous cycle of learning. One will then wonder why leave boys behind. Empowering women help us all. It is not us versus them. Women come with men, children, grandfathers, and everybody in the family. Everybody wins. Empowering women empowers all.
Thank you so much, Patricia, for sharing your personal story and for using that as an inspiration to continue with your work and scale it up and help the women around you. So now I'll move on to our third panelist, which is Sarah Keeler, the Community Engagement Coordinator at Canadian Women for Women in Afghanistan. Who's Sarah? Well, Sarah manages communications and engagement activities at Canadian Women for Women in Afghanistan and leads global advocacy on the Afghanistan Policy Dialogue Committee. She has a background in anthropology and participatory research and has worked globally supporting youth and women affected by conflict and violence in such places as Iraq, Turkey, Mexico, Uganda, Kenya, and Afghanistan, as well as with refugee women's organizations in Canada and Europe. She is passionate about women's rights and a strong believer in participatory approaches to development that put local people and cultures at the center of decision-making. Sarah, thank you for joining us. Now your question is, how have you been able to conduct gender assessments and use participatory approaches to achieve strong gender equality outcomes under COVID-19 barriers?
Thank you, Rita. Can you hear me, everyone?
Yes.
Okay, thanks so much, Rita. Well, the mission of Canadian Women for Women in Afghanistan is to support the empowerment of women and girls in the country through access to quality education. So as an organization whose entire mandate is really to do with providing quality gender responsive programming, these processes and approaches that you put forward are second nature for us. A gendered lens is at the core of what we do. And we're fortunate in that our relations with both program participants and locally based staff through our country office give us such a strong basis for ensuring these participatory approaches that have been instrumental in responding to the challenges of COVID as they emerge. We relied heavily on the skills of facilitation and relationship building of our country office staff. And so really, I just want to give kudos to them because they're the people who enabled all this. And so I would say from an early on, within the pandemic as it emerged, our focus was on ensuring continuity of learning opportunities for the girls and women who participate in our programs. And our Technology for Education program area enabled us to provide resources that would facilitate that. For example, in supporting the Afghan Ministry of Education in their own pandemic response, and we provided content for home learning packages on TV and radio in partnership with them. And this was also a process of ongoing dialogue in which we heard the needs and wishes of community members as they emerged in that rapidly unfolding context. So for example, we were just about to launch our new gender equity and teacher training project, working in teacher training colleges across Afghanistan when the pandemic hit. So as teaching colleges shut down, we were able to pivot the resources for that project into creating content for children and families by developing and sharing video lessons in 7 subject areas. And ongoing gender assessment of that content and ensuring that home learning was available led us back to the editing room several times to ensure that our educators were really presenting good gender responsive practices. So there was a really iterative process that reflects that kind of conscious gender responsive approach to teacher training that we would normally undertake in face-to-face delivery, but which became all the more vital in the context of distance learning. And additionally, for households that have less access to technology, we also distributed what we called learning baskets, which contained a range of educational resources for all ages in the family and as a way to encourage learning and family activities at home even during lockdown. And these baskets also contain practical resources that we're in most need in the first phase of the pandemic, like hygiene items and food kits to complement our adult nutrition and life skills curriculum. And this was a direct response to feedback from women in our programs that such usable items would facilitate the participation of husbands and family elders who were maybe more skeptical about our projects, and we could then easily demonstrate the practical benefits of healthier, well-fed families, which not only then provided for the acute basic needs during the health crisis, but increased participation amongst harder-to-reach households. And in this way, we were able also to incorporate messaging around virus prevention and women's rights, which further increased safety. And it was just a way for our staff also to check in with the program participants in a way that was safe. But we also know that access to education can only happen if we're working to reduce barriers in other areas too. So for example, we have a girls' school that serves marginalized communities in Kabul and provides education for some 400 girls in the area, most of whom come from single parent families or those who have been internally displaced by the conflict in Afghanistan. And normally they would receive a hot meal as part of their school day, and this would be the main source of nutrition for many of the girls and their families. So when the pandemic hit and there was an extensive lockdown in Kabul, it obviously had a huge economic impact because most of the families are reliant on income as market traders or tailors, and this work completely disappeared during the first phase of quarantine. So when we spoke with beneficiaries, we quickly realized that hunger would actually be a major issue for them even before virus exposure, and that this would be a double burden on women who are already disproportionately responsible for care duties in the family, and who also rely on female children to support that household labor. So in response to requests from mothers in these households, we set up an emergency food package distribution, and we're able to provide food throughout the first several months of lockdown for more than 2,500 individuals. And our goal here in responding to program participants was not only to feed hungry people, but just to reduce one source of stress for families and to minimize the barriers for girls to continue their learning during lockdown. So these are just some of the concrete ways we utilized our usual practices of gender assessment and really community identified priorities to ensure women and girls were safe and could continue to inspire to further educational goals, even during the worst period of COVID-19. And I think if I could, in closing, I would just also add a caveat, though, in terms of our theme of today, both of the panel and of the conference as a whole. The fact is, COVID-19, I think, what isn't seen as a singular crisis for many people in Afghanistan in the same way as it has been experienced elsewhere. As we speak, actually, Afghanistan is undergoing intra-Afghan talks around peace negotiations, and to a very large extent, women's rights hang in the balance in that negotiation. And so I think many of our program participants see that as a more imminent situation. And you know, just a reminder to think about what constitutes our ideas of crisis or threat are largely based on our positionalities. So we had to take into account that there were other concerns that remained for our program participants as well. Thank you.
Thank you so much, Sarah. And I totally agree that it might for some countries be one crisis, but in many parts of the developing world, they have, I would say, a mega crisis, like a series of crises compounded on top of each other that need to be considered. So kudos to your work, and it's incredible to see how you've been able to tackle the issues in light of COVID-19. Now moving on to our next panelist, our fourth panelist, which is Danielle Skogen, the Program Development Director at Canadian Humanitarian. A teacher by trade, Danielle has always believed that education and empowerment are the keys to eradicating poverty and ending injustices. Danielle graduated from the University of Alberta with an education degree with a specialization in French immersion. After a few years working as a classroom teacher in Calgary, Alberta, she moved to Guatemala, where she worked in a leadership position for a Dutch-Guatemalan NGO for 3 years. In her first few years in Guatemala, she recognized a critical unmet need in Guatemala, the empowerment of girls. Determined to make a difference, in 2014, Danielle partnered with Real Girl Empowerment Program's founder, Anea Bogue, to co-found Ser Niña, a program that provides empowerment workshops to over 400 at-risk youth every week. Ser Niña recently partnered with Canadian Humanitarian, where Danielle now works. As Canadian Humanitarian's Program Development Director, Danielle is helping Canadian Humanitarian to grow their existing programs and bring the Real Girl programs to their Ethiopian participants. Thank you so much, Danielle, for joining us. Your question is, how has your organization managed to create stronger, more inclusive and impactful collaborations with local NGOs during COVID-19?
Thank you, Rita, and it's just such a privilege to be here sharing with all these amazing minds on this important topic. So I really was happy when I saw this question because Canadian Humanitarian and the Real Girl Foundation are both really built on the idea that we can only create impactful change in developing countries when we're doing that in very close partnership and collaboration with local organizations and local authorities. So to really kind of bring that context to COVID-19 is a really great speaking piece. So just to demonstrate that, Canadian Humanitarian, half of our centers are run by local organizations that we partner with directly. So we have a completely local staff in Ethiopia, over 70, and local decision makers that are represented by the communities that we serve. In Guatemala, through the Ser Niña program, we actually only work in collaboration with local schools and organizations, and all of our after-school support programs, our girl empowerment, gender equity, and positive masculinity workshops are only done in collaboration with local organizations or schools. So that's always been a foundational principle of Canadian Humanitarian and the Real Girl Foundation, and we've had to really lean on those local partnerships since the outbreak of COVID-19 and really have had an opportunity to strengthen those partnerships as well. So specifically in Ethiopia, we've always worked in, as I was saying, in close partnerships with our local partners. And we've actually been able to see how we've been able to really strengthen those partnerships. We've actually seen the benefits of not only us working closely with them, but them all working really closely together. We've been able to eliminate certain costs and certain the expertise, the learning, and the experiences of all of our local partners together. One of the biggest and clearest examples was when we realized that one of our big initiatives right now in Ethiopia is giving food hampers and sanitation hampers to each one of our over 400 families. And when we had each of the partners buying those individually, it was not as cost effective. Now that we've realized that we're doing that for the long haul, we actually have been able to centralize the purchasing so that we know which communities we can get which product the easiest. And we've actually been able to provide more food than before because we're able to really recognize what's the best way to purchase for all of our local partners. And they're all working together to really understand how they can best support the students in their programs by leaning on each other and by learning from each other. Additionally, in Ethiopia, we've always worked really closely, not only with organizations, but with local authorities, with the kabeles and the local governments to really make sure that we're providing our support to the most vulnerable situations. And we've really strengthened that. Since COVID-19, we've worked really closely with the kabeles to make sure that we're not overlapping services and we're not doubling up and there's no reinventing of the wheel. We really work, and our program managers work with their local governments to understand what each local government is offering, what some of the gaps are, and how Canadian Humanitarian can step in to help fill those gaps, not only for our participants, but in some cases we've supported other community members as well as needed. And we're also working closely with ministries such as the Ministry of Women and Children's Affairs to really better assess and understand what are the core issues, not just with the families that we're working with, but overall in the community, so we can make sure we're having the greatest impact possible with the communities. In Guatemala, through the Real Girl Foundation of the Ser Niño branch, it has been a similar approach to really leaning in further than ever before with those local partnerships. I think it's really important that as organizations, we understand, we stay in line with our mission, even in COVID-19, and understand where our areas of expertise are and where we still need to learn. So in Guatemala, for example, we've never done relief services and food services, but when that was identified as a major need in our communities, instead of us trying to learn how to do that and not maybe doing it as well, we actually partnered with a local organization that was doing food relief services, and Las Manos de Christine actually was able to provide food hampers to 2 of our partner communities. And we were able to target our resources to continuing our work in gender equity and girl empowerment. Additionally, we've also been able to really look at the shadow pandemic, which is our core focus with the violence against women and girls in our communities. And with that, we've actually been developing a holistic response to violence against women and girls. And for that, we've really built new partnerships and strengthened old ones with organizations that are expert in that field. We have legal organizations, social and emotional health organizations, group therapy organizations, and educational organizations, as well as safe houses. In Guatemala specifically, we're seeing 54% more cases of domestic violence coming in each day than pre-COVID. So it's really a growing concern, and we're seeing that also demonstrated in the increasing rates of teen pregnancy. So we're working hard to address that need. So since COVID-19, we've had not only the push, but also the great opportunity to strengthen pre-existing partnerships and also seek out new ones, which we're looking forward to continuing, hopefully beyond COVID-19 as well. Thank you.
Thank you so much, Danielle, for highlighting how you've been harmonizing your efforts with local organization and ensuring that the ownership is within their hands and that they're at the forefront of the impact. So thank you for that. And last but not the least, our 5th panelist, who is Lorraine Swift, Executive Director of Change for Children. Lorraine is the Executive Director of Change for Children, which has worked since July 2002. As the Executive Director, Lorraine has led the organization through a process of growth and specialization in themes such as technological innovation, sustainable resource management, gender equality, and Indigenous rights. Previous to her work with Change for Children, Lorraine lived in Managua, Nicaragua for almost 4 years, where she worked as a CUSO cooperant on various initiatives promoting territorial rights and self-government with the Miskito and Mayagnan indigenous people of the Bosawas Biosphere Reserve, which they have since obtained. Lorraine has a bachelor's degree in Native Studies from the University of Alberta and previously held various positions with groups working in Alberta's environmental movement. Lorraine is currently studying a graduate diploma in international development for the University of London School of Economics and a Woman in Leadership Certificate program through Cornell University's College of Business. Thank you, Lorraine, for joining us. And now your question is, What have been the greatest financial and logistical challenges to achieve gender equality outcomes during the pandemic? And what are your recommendations to overcome these barriers?
Thank you very much, Rita, and thanks to ACGC for giving me the opportunity to speak today. It's always a privilege to be part of the Alberta Council for Global Cooperation. Here in Alberta, we have a really a culture of collective action and cooperation rather than competition amongst the INGOs. And of course, ACGC plays a central role in fostering and nurturing that culture, which is particularly evident at events like these. So what are the greatest financial and logistical challenges to achieving gender equality outcomes during the pandemic? Well, this is an interesting question, and really one in its various iterations that the sector, the international development sector, has been grappling with for 3 decades. How do we achieve gender outcomes in the context of conflict? How do we achieve gender outcomes in the context of climate change, in the context of the loss of traditional territories of Indigenous people, increasing domestic violence, the local and global health crisis in the context of a pandemic? So what we're really saying is, how do we achieve gender outcomes in an increasingly complex and changing world? Or perhaps more appropriately, how do we achieve gender outcomes while we are constantly facing threats to our survival and to the survival of our families and communities? Stepping back a bit, I wish to provide you with some brief context of Change for Children's work that occurs in very remote communities in Central and South America, in Indigenous communities mostly, that are extremely vulnerable to climate change. Resources are scarce, and much of our work is focused on helping to manage and distribute those resources in sustainable and equitable ways. So women and girls are already impacted the most from the effects of climate change in these regions. They're the ones who fetch water, who look after the household, who care for the young and the elderly, who care for the sick, and who in many regions where resource extraction or agricultural work is going on, women are the ones who occupy the most precarious and short-term informal jobs, prepping agriculture fields for sugarcane and peanut seeding, weeding, pesticide application and harvesting, or cleaning up after the harvest. Similarly, in the remote Indigenous territories in Bosowas, where the people live from subsistence agriculture, there are no formal jobs. So women pan for gold along the Rio Coco, Central America's largest river that forms the border with Honduras and winds peacefully through the ancient Indigenous territories from the Central American mountains to the Atlantic Ocean. So it's in these contexts that the pandemic has actually offered us an opportunity to check in with women and ask them, how are you coping? What are your stories? How are you keeping your families and communities safe from yet another threat to your survival? So Change for Children's largest investments at the moment are in Nicaragua. And there we have a large water and technology for water management project financed by Global Affairs Canada that we're carrying out in the northwestern part of the country. And we have another large project in the jungles of Bosowas, Nicaragua, with the Miskito Indigenous people that involves technology for education, most specifically teacher training, emphasizing gender equality, access to sexual and reproductive health and rights resources for teachers and students. And the project also facilitates access to curriculum materials in the Miskito language. And this tech education project is funded by the FIT. So I suppose in this context, you could say that at this point anyway, we've been a bit lucky, I suppose, because the Nicaraguan government, perhaps following the lead of the US, or not actually sure why they made these decisions, but they have not implemented many measures at all to shut down the economy. They didn't close the schools or the airports, and they've basically tried to continue as far as possible in the global context, their economic and social recovery from the civil unrest and political crisis that occurred in 2018. And so in that context, and following the advice of the World Health Organization, we've continued to implement our projects during the pandemic. And because our projects involve technology, we've been able to convert most of our activities to an online or virtual format, where gathering groups of people together is not safe. But although gender outcomes we are aiming to achieve in both projects continue to be our priority, we are at the same time, we realize that the whole of community approach is necessary to really achieve change. So we offer virtual training to our facilitators who go on to train community water committees and teachers in gender themes, But we lament the fact that we can't hold community workshops with elders and Indigenous leaders and the rest of the people in the community that really are the ones who need to digest these things on a long-term basis. To address the financial part of the question, the conversion to an online format is actually saving us money because we're not traveling to the region to monitor the results and we're not sending in external consultants to evaluate. So we're investing those saved funds to extend the timelines of our projects so that once we're able to gather in groups and travel again, we can carry out the more robust whole of community and regional activities that are our main goals in advancing gender equality. So I'll just finish up here by saying we've been very fortunate that our funders have been accommodating and understanding throughout this pandemic. When we share the stories of women and girls and how they are facing the pandemic and coping with the challenges, funders have been very helpful and of course remain interested in ensuring that their investments will still achieve their intended impacts. So as we share those same stories of women with our funders, we also share them locally in the regions where we work, using women as examples of the people on the front lines of the pandemic, as examples of innovators, examples of those doing everything they can to safeguard their families and communities. And we're celebrating and honoring those women that locally and globally, by educating ourselves and our donors and our funding agencies that support these projects, we can all gain a little bit more of an understanding of the challenges that women are facing in the context of the pandemic and learn more about how we can support them in their struggle. Thank you.
Thank you so much, Lorraine, for showing us how impactful and one can be as impactful and effective in a crisis with funds, limited funds, and also how great technology has been in regards to the development context. Now, before we dive into the questions and answers for the audience, we actually would like to show you all a video of the work on the ground that is being executed by the 5 organizations. So Lasha is going to play it for you. It'll be about 5-6 minutes. And in the meantime, if you can think of any other questions, please don't hesitate to put in the chat box. So Lasha, if you want to play the video. Thank you.
Many people lose their sources of income, thus creating tension in homes. And this has led to a rise in gender-based violence.
Y el cargo de las mujeres se ha duplicado en la casa con el cofinanciamiento, porque ahora los niños no están yendo a las escuelas y una carga más para las mujeres, o sea, el trabajo se ha duplicado.
Se hace muy difícil, ¿verdad? Estar pensando en qué momento me contagio, en qué momento se contagia mi hijo, en qué momento.
They are just sitting at home. They don't have anywhere else to go. They don't have anything to do. There is no way that they can put food on their tables.
Thank you, Lasha, for playing this snippet of the gaps that we are facing. Okay, and she also actually posted, if you want to watch the full video, I thought it was going to be the full video, but I know we're short on time. So if you look into the chat box, she posted the full video, which is about 6 minutes, that shows the gaps and how these 5 organizations have been delivering on their objectives on the ground. So now we can open it up to the floor for our audience, and we have a few minutes. We have about 6 minutes to be able to answer the questions. So I can ask the first one by Sent Setsa, and this question is directed to Patricia. So Patricia, how are you able to continue to support and lead Sihle-Sizwe from the other side of the world? What have been the challenges of your work during this crisis? And just as by the way, can you please tell us, what does Sihle-Sizwe mean? Great inspirational work. Thanks for sharing.
Sihle-Sizwe is derived from a Ndebele word in Zimbabwe. It's a Ndebele language. Sihle-Sizwe means a beautiful nation. Beautiful nation. At the moment, it's been very difficult to continue sewing as the shutdown was going on. Everybody had to stay home, and there was some kind of violence if people moved. So the women had to stay at home and take a role of being a caregiver. So it's been very difficult. I'm glad to say right now they are slowly going back to work. They are able to go back to work. So they are starting sewing. But as we were checking and seeing what they were asking them about the challenges they faced during the pandemic, we are seeing that there was a lot of domestic violence. So we are finding ways of dealing with that after COVID. But we in Zimbabwe, we have a board and members who are working, and we created a board and leaders in Zimbabwe. So we don't operate and channel it from here. We have people who are responsible in Zimbabwe, and we have coordinators in Zimbabwe. So most of the time it's about communication, and they give us the feedback, they meet with the ladies. So I'm glad to say our women are back to work.
Thank you so much, Patricia, for that. I'll move on quickly to the next question by Shar. Oh, I think there was three, now there's two. Okay, this question is directed to Lorraine Swift. So you mentioned the use of technology, which has been a key feature of coping with the pandemic in many parts of the world. How have women in the regions you work in leveraged technology during the pandemic?
So we were actually very lucky to have our technology project already running in Nicaragua, both in our water committee training program, which equips water committees, local water committees with technology like smartphones and tablets and various chat applications and a website so everything was already automated to provide for this online training. We were still doing workshops because we found that it was better to, train them in person, how to use the technology. But we were at a perfect perfect for the pandemic stage in the project to be able to then move, they were already able to use that technology, and then they were able to continue the training online. In the case of Bosowas in the indigenous jungle, we had just deployed, I was actually there in early March, and we had deployed, installed all the solar and deployed all the laptops in the schools and put in the digital library, and we're just about to begin the teacher training when, people were told to come home and stay home and all of that. And so we were still able to, because we have local indigenous people facilitating the training. We're continuing to carry it on within the schools with the teachers. And so actually we were able to use the technology as well to distribute health information, which the Nicaraguan government was less responsible in distributing to, especially to the most remote communities. So we were able to create modules that, by the World Health Organization in the local iteration in Spanish, Central American version, and share all of those with the communities that we serve. And also the transportation that was provided by the projects to, move back and forth between the capital city and those remote regions. We were able to leverage that and bring in, sanitation supplies and personal protective equipment as well. So, it was just sort of a perfect timing for us, because I think that if you tried to distribute technology without the proper training, like now in the context of a pandemic, it might not work, but we had sort of already trained people to use it. So it works really well. I mean, that said, most people in the developing world have cell phones and increasingly more smartphones. So there are ways to kind of provide the apps and the information to people to use.
Thank you so much, Lorraine. I have so many questions popping up, and we have less than 2-3 minutes left. So I'll pick just two more. And then hopefully, if you want, you can get in contact after and we can try to answer the questions. They're all good. Oh my goodness. Let me just figure out which one. Okay. It's whoever would like to answer. This is for all the panelists, coming from Nico from Spur Change. So, including the voice of women and girls in data collection can often be challenging due to many factors, economical, cultural, and family structures. How have you maintained and sustained your efforts to monitoring and evaluation during the pandemic? Whoever would like to answer this one, first person to just unmute and talk. So this is regarding monitoring and evaluation. Yes, Danielle, Skogen, please go ahead.
Yeah, so this has definitely been a really big challenge, but something that we've been really focused on at Canadian Humanitarian and at Real Girl. I'm actually part of the Spur Change training right now, and it's really interesting to hear how different groups are doing it. We do work with extremely remote and vulnerable communities, so a lot of organizations, we just don't have the access to technology. So we've done everything. We've been on the phone a lot, making sure that we're connecting with the participants and the families in our community to really make sure that we're getting real needs assessments happening and not just the assumptions that are coming from our centers or just from our team here. So making sure that we're calling them and speaking with them. We've even used, WhatsApp. It's a very grassroots approach, but that is a way that we've been able to connect with a lot of our beneficiaries in our programs. And it's even gone as grassroots as we have program managers on motos that are visiting our families once in a while, checking in on them monthly to make sure that we're able to assess them. In Guatemala, where we do have more access to technology, we have been able to do some more structured surveys, and we are moving to a more online process slowly. Unlike Change for Children, we weren't there quite in time for the pandemic, but we're getting ready as we go.
Awesome, thank you, Danielle. I'll go to the next question by Kristen. Also to any panelists that would like to answer this. Do you have any advice for youth looking to get involved and gain experience in international development? So this is for our youth, our future leaders, current and future leaders. Anyone would like to share some advice?
I would say just, research organizations that you think are doing really interesting things, reach out to them and ask, how can I help? As a youth, no one's likely to turn you down. An organization might not have a volunteer opportunity at that time, but it's definitely, I know we've taken on some youth volunteers that have turned into employees of our organization now. So you never know what's possible, but reach out, ask questions, ask for a virtual coffee chat, and people will be willing to give you their time, and know what you can offer an organization as well. Whether that's doing research, helping with social media, doing donor research, but kind of have an offering and just reach out and try and connect and engage with them.
Thank you, Danielle. That's awesome. This question is coming from Leah Itar. And this is for Sarah. Sarah, you mentioned working with local governments. Given the crises, has your work and relationship with the various levels of government changed, been strengthened, weakened? What are your thoughts or your experiences regarding the change of relationship with the governments that you've been working with? I think you're on mute, Sarah. Sarah, one moment, you're on mute. Do you want to unmute maybe the telephone line? There we go.
Can you hear me?
Great.
Can you hear me?
Yes, we can hear you.
Yeah, great. So, yeah, great question. I think definitely, as I said, we quite early on became actively involved with the Ministry of Education's pandemic response, and they incorporated a lot of our resources that we were developing to sort of facilitate home learning. I mean, we always have fairly good connections with the Ministry of Education. We work with their gender units in each of the provinces in Afghanistan where we operate projects. But I would definitely say that this has kind of deepened that partnership. And as I said, we're probably more on the radar in terms of our Technology for Education program area. It does include a lot of resources for online learning and always has. And it's a little bit interesting because previously, I think the perception of Afghanistan, just in a general sense, is it was a hard sell actually for us to kind of demonstrate the use value of technology for education in a context like that. But it became so central to everything that was happening, and we were really well positioned to be able to kind of demonstrate how that is, and that came about through this increasing partnership with the Ministry of Education, both at the national level and also within provincial governorates. So yeah, it's been a really wonderful deepening of that relationship and an opportunity for us to kind of demonstrate what those resources can provide.
Thank you so much for that, Sarah. I have one last question, actually, if we can answer in under a minute. One or two more, okay. Sarah, again, you made a link between our topic today, looking at women and girls, and our topics yesterday on race and positionality. Have you made any observations on how women and girls in your project countries might be perceiving this pandemic and its effects on them, and what their pressing needs might be? This is coming from Rumbi from ACGC.
Thanks, Rita and Rumbi. Yeah, great question. Again, I mean, I think this touches on kind of my closing caveat in my 5-minute answer. COVID is obviously a global crisis, and everywhere, Afghanistan is no exception. It has, deepened those gender inequalities, and the effects are disproportionately felt by women and girls. However, also, I think, it bears remembering that we shouldn't approach these questions with too many specific assumptions, because what we really found in talking with our beneficiaries is that yes, COVID is there. It has it creates concerns in terms of economic considerations, obviously, and labor burden for women, access to education, of course, because the women who participate in our programs really rely on that as a safe space, and then the girls as well. But also that, as I mentioned, Afghanistan, as just one example, is currently experiencing a peace negotiation with the Taliban, which risks a complete backslide on all the massive advances that have been made in rights for women and girls in areas of education, healthcare, personal emancipation over the last 2 decades. And this is really, essential. This is a much more pressing crisis from their point of view in terms of threatening all of these issues. And so I think, it really comes down to that question of positionality. It's very easy for us to kind of, and when we're having all these discussions, to kind of center it around COVID, and COVID is there, but it is perhaps a concern for women and girls in Afghanistan in that it's compounding, things that are already there, and there are overarching issues that they're facing that I think precede that.
Thank you so much, Sarah. I know the time constraint isn't very helpful, but great at answering it. Okay, so I know there's one more question, but I think it can be answered through our last segment of this session. So the way it's going to happen is I'm going to ask a question for each panelist. It'll be the same one, and if you can answer in under 30 seconds, not 1 minute, answering in under 30 seconds. So I'll just name your name, and then if you can, I'll name the names in regards to the order that we had started with the introduction of the panelists. So we will be starting with, let me see who we started with. We started with Danielle, Gibbie. Okay. The question is, let me find it. Okay. What is your call to action to effectively and sustainably advance the empowerment of girls and women in a pandemic and post-pandemic era? Call to action.
I have 3 quick points on this. So 1, an intersectional lens must be at the center of our response efforts. This includes gender, race, ethnicity, disability, socioeconomic status, and more. 2, we need female representation across all levels of work, especially in leadership positions when there's critical decisions being made. And 3, we need continued stable funding available to Canadian organizations who are working locally within communities designed to help us continue addressing the needs and barriers faced by women and girls.
Awesome, 31 seconds, great. Thank you, Danielle. Now moving on to Patricia, same question. What is your call to action to effectively advance the empowerment of girls and women in a pandemic and post-pandemic era? Patricia.
I think the most important thing for me is the finding ways of reporting gender violence, as well as getting maternal reproductive health services to women, especially in the rural areas and in countries that are less advanced and less, in countries that are less advanced, yes.
Thank you. Thank you so much, Patricia, great. Now for Sarah Keeler, your call to action. And then just unmute your phone. Yeah, thank you.
Thanks. Yeah, I guess in brief, my call to action would be in relation, again, to the themes of this the wider themes of the conference and sort of some of the points that were raised a bit earlier, to say that some of us should perhaps be acting less and listening more, and that maybe let's focus on the agency and the active voice of women in the majority world and then respond to their calls to action. In our own work at Canadian Women for Women, around advocacy, and particularly we've been trying to think really consciously about which voices we're centering and whose definitions of advocacy, solidarity, and empowerment we're advancing, and recognizing that these definitions can and should be diverse. So those of us who hold privilege can bring our resources and expertise in the service of women's activism in the majority world and really elevate their work as change agents.
Thank you so much, Sarah. And now for Danielle Skogen, what's your call to action?
I think we really need to be looking at the shadow pandemic right now and not only be focused on preventing COVID-19, but really looking at solving some of the consequences and repercussions that have come from COVID-19, including the escalating levels of domestic violence. It's hard to see advancement of girl and women's empowerment when so many are caught in cycles of perpetual violence. So really making sure that we're ensuring safe spaces for girls and women in developing countries to have places where they can report violence safely and then also receive the services they need to come out of those situations of violence, whatever that looks like to them. And also making sure that we are connecting with safe houses and providing a holistic response. You know, violence response is more than just the legal piece, it's more than just the psychological piece. It is a collection of responses that we need to be offering the women that are living in these situations. So I think just really focusing on that shadow pandemic is what we need to be doing right now as well.
Totally. Thank you, Danielle Skogen. And last panelist, Lorraine Swift, what is your call to action?
I just have 3 points as well. The first is let's not lose sight of the SDGs, right? The Sustainable Development Goals. Now more than ever, the world is showing that we can chart a global path and in response to COVID, and we need to do the same thing. We're fortunate to have this global roadmap already available to us, and we need to use it and work together, championing the SDGs as we build back better. The other one is sustainable funding, particularly for small and medium-sized NGOs. We've proven that we have impact, we have ability to engage Canadians, we innovate, we're agile, and we need stable funding. And the third is just let's act in solidarity with women as the world becomes a little bit kinder, a little bit more open to the perspectives of different cultures, Indigenous people and of women. We need to work together and in solidarity to ensure that women are present wherever decisions are being made. Thank you.
Awesome. Awesome, ladies. Thank you so much. Now I'm just going to wrap up. I know we're a bit past the time, but just wrapping up, and then we can move on to the next part of your days. So the way I'd like to end it is the fact that we recognize the ongoing good work of the Canadian international development sector, including all of your work, your resilience during this unprecedented time, and your ability to swiftly pivot to address COVID-19 as part of your policy and programming efforts. What we need to do is we need to continue to harmonize our efforts and support vulnerable populations where possible, including support for sexual and reproductive health and rights, maternal and child health, food security and nutrition, education, the provision of humanitarian assistance, and programs aimed at combating gender-based violence, everything that you said, ladies. So I would like to sincerely thank our 5 panelists, Danielle Gibbie, Patricia Gumbo, Sarah Keeler, Danielle Skogen, and Lorraine Swift for taking part in an enlightening and inspiring conversation on how we can all continue to support and empower our women and girls around the world. And thank you to the Alberta Council for Global Cooperation for this amazing opportunity. Now I'm supposed to invite you all to attend the next session. I think there's something's supposed to come up, Lasha, or if you want to say what the next session is. But
yeah, thank you. I would just like to say thank you so much to Rita as well for moderating this very insightful panel. And yeah, so next, if you just watch this panel and you're wondering what you can do as an organization or as an individual to address gender inequality or racism in your work, you can join our coffee chats, which will be at 1 p.m. Mountain Time. And you can choose between the race or gender coffee chat. The gender one will be moderated by Oxfam Canada and the racism session by Equitas Canada. I also want to say that during the last 2 conference days, be sure to check out a documentary. The link will be in the chat called Burkinabe Bounty. It's about how the Burkinabe people are reclaiming their land and defending their traditions against the encroachment of corporate agriculture. So again, thank you to everybody for joining this panel, and have a great day.
Au revoir tout le monde. Thank you, everyone. Hope to see you in person
Thanks
one day.
All.